Good evening, friends. Welcome back to our integrated session. Today we have three cases and there are three different age group. A child's case, middle-aged female and the elderly parent. And we have explored the case lot in details and you will understand the remedy, three aspect of this remedy. And today's our speaker is a dynamic lady, Dr. Shobha Shah. Welcome, Shobha, and share your cases.
Thank you, Nirupama. So, friends, today I am going to share two cases. The remedy that we are going to explore is Alumina. And I am going to share two cases. One is of an adult of a 77-year-old and the second is in a child who is 14-year-old. So friends, what I have seen in my practice is that Alumina is comparatively easy to spot in the children's age group. But in an adult group, it is a bit difficult, because there are some features which are very subtle and it sometimes really confuses you also to understand them and to prescribe. So now we will try to understand it through our cases. So Aditi, can you share my screen?
Yeah, sure, Shobha. Just give me a minute.
Yeah. So friends, this is a case of a 77-year-old male patient, and he was brought to clinic by her daughter-in-law. And when he came and he told me that doctor, मुझे मानसिक बीमारी है, and I am having a depression. And I asked, okay, what other things, meaning what also? He only went on saying, and I have a very bad constipation for many years. Like, the stools are very hard and I just cannot have the results without taking the liquid cremafin. I must take cremafin and I'm taking cremafin for many years now. And I also have a prostate problem. I have increased frequency of urination at night. I get up so many times. And I have GERD. I have heartburn. So he himself went on saying, giving the diagnosis also, what he's having, the GERD, and I have backache. I'm not able to sleep at night. I have a lot of weakness also. Aditi, next, and will you make it full screen? Yeah. So now this patient and his family is known to me for quite a few years. So now the patient's wife had already complained to me, that what is happening is that she said this patient, what he does is he visits so many doctors. He goes from one doctor to another, from the second to the third and third to fourth and fifth doctor. So he visits so many doctors and he goes to these doctors without informing the family. And so family doesn't know. And it is what happens after he returns from the doctors. Either he comes home and he tells that, okay, doctor has advised me to undergo endoscopy or colonoscopy or the prostate operation. And what should I do? Or he brings the medicines, and he brings the files of the doctors at home. And that time the family comes to know, okay, he had visited a doctor. So the wife is getting the very uncomfortable and getting troubled by this patient's behavior, that what is he doing, and we are explaining him that at least you tell us when you are going to the doctor, either we will accompany you or why you are going. So but this is the behavior of the patient, that still next time he will go alone to the doctor and he will come back and then the family will come to know. So with that, the patient has a bunch of the files, which is collected. He has visited so many doctors. So during the interview, when the patient was talking about he visiting the doctors, he was saying as if the way, meaning what I perceived is he had knowledge about lot of different consultants, their clinics, their degrees, their timings. He also knew about what diseases he has, his signs, symptoms, because he keeps on reading it in the newspaper columns, and he used to again describe and he used to correlate that, okay, I read so and so in this newspaper. So I asked him, okay, how did you come to homeopathy now? So he said, doctor, 2 days ago I had been to my family doctor and I told the doctor that I want to undergo now prostate operation. So you tell me, suggest me which doctor and which hospital I should go. So the family doctor, she wrote down the pre-operative, all the investigations in a paper, and then she kept that paper aside with her, and she told the patient that you have come to me 50 times, but you are not deciding anything formally. You are not taking decision of this operation. Every time you are coming and telling me that you want to undergo operation, and then you are not turning up again. So you do one thing, you formally decide first, and then whenever you take 2 days time, decide formally, and then come and let me know. Then I will give you this. We will get your investigated pre-operative investigations, and I will suggest you the name of the hospital and the doctor also, and we will get it operated. So patient goes away from there, and then he said, "Ki when I went from that to my home, so there was one neighbor. He told me that he had been to an Ayurvedic doctor for his sciatica problem." So I went to that Ayurvedic doctor, and that doctor suggested me, okay, you need to do Panchakarma. And so I came home and I told my wife, the doctor has suggested Panchakarma. And so my wife is saying it is so hot outside, the weather is hot. And in this hot weather, you will do steam and everything you will take. No, no, we don't want to go to the any Ayurvedic treatment. We don't want to do all this. So then patient kept quiet and he said, so after that, again, he met another neighbor of him. And that, while talking about his complaint, he was telling, so that neighbor said, I am taking homeopathy, and homeopathy is the best medicine. So this patient came home and he said, I want to take homeopathy. So what happened is family was telling him since many long time, you take homeopathy, but he was not getting ready. And today, as soon as he heard from the neighbor that homeopathy is good, and he said, he expressed his wish, okay, he wants to take homeopathy. Family, his wife and daughter-in-law, they immediately decided to bring him to clinic, and the daughter-in-law accompanied him and immediately brought him to clinic. And that is how he brought to the clinic. And while telling this, he was, giving a smile, which was a very a different type of smile. So I said, okay. Then what happened is, so I asked him, okay, so when you visit to so many doctors, so many files that you have, so is it that somebody is suggesting you something or suggesting you this doctor or that doctor and you are going? And he said, yes. And there was again a laughter on his face, And that time the daughter-in-law who was sitting there, she said, whatever he reads in the newspaper, he thinks that is happening to him. If he reads in newspaper that the outside temperature is 40 degrees, he will start feeling hot. If he reads in the newspaper something as about the disease, he will start feeling it is happening to him. So what came to my mind is okay, when you are listening to others and you are thinking, okay, as soon as somebody is telling you something, you are ready to, you're just going there without understanding, without thinking anything. I mean, where is your thought? What are you doing? I mean, are you understanding what you are doing? And what struck to me was, is his head on his head, or it is like, he's operating from somebody else's head. Whatever somebody is saying, he goes. Like if somebody said you go to the Ayurvedic, he will go to Ayurvedic. Somebody said you go to homeopathy, this is good, he will go there. Somebody is giving the name of the urologist or the gastroenterologist, he will immediately go there. So what struck to me was the rubric, like, head belongs to another. I felt that maybe his head is not on his head, and it is like he's following something. He's following somebody the other person's head, what the other person's thoughts are. So friends, what is thought? What is head? The head is the one which generates the thoughts. And these are the thoughts. Our thoughts gives us our identity. So I felt like, while talking to this patient, that maybe is he having some any identity issue? So I just kept that thing in my mind and I thought, okay, let me go ahead in the case and see what the things are coming up further. So,
Just one second. Yeah.
So then what was happening is this patient, the wife said he has lot of medicines, whatever the doctor is prescribing, he will go and buy it immediately. But he will not take those courses completely. He will hardly take one tablet from it, and he will keep the rest of the 10 tablets, in the home only. So there was a big medical store in his house, where all the medicines got collected over there. So I asked him, okay, then why are you not taking the medicine courses completely when you are going to so many doctors? So he said, no, there are some medicines which are producing heat and which is giving rise to acidity. So he's not taking those medicines. But I said, what about the other doctor's medicines? So he said, the patient is saying, this is patient's worth, this is my biggest weakness. I don't take medicines. But why he doesn't take? Sometimes he says, I forget. Aditi, next. He says, either I forget or I don't know. I don't know why I'm not taking, but I'm not taking. So somewhere what I felt is, at times I felt, okay, he is objective, reasonable. He's talking little reasonably. Okay, those medicines are producing acidity and producing heat to him. It does not suit him, and that is why he's not taking. But at times, like, he was answering very vaguely. Okay, no, I don't know why I'm not taking, because either I'm forgetting or what is happening. But it was for sure and short. Then I was asking him, then why are you bringing it? But no, he couldn't answer. But he used to get that morbid impulse to buy the medicine for sure and short. He will buy it and he will keep it at home. He may take one tablet, but then he will not take. So then I again asked him, okay, what is the mental disease you are telling me ना कि मुझे मानसिक बीमारी है, तो आपको क्या मानसिक बीमारी है? He said, नहीं, but मेरा दिमाग ही एकदम खराब हो गया है. He couldn't describe further much, but somewhere he was aware about what he was doing, going from one doctor to another, and the family also scolding him. But then he was not able to control this morbid impulse of going from one to other. So he was understanding, but he did not tell that clearly. And he also said that doctor, I forget everything, and I am losing the interest also. I feel very dull and sort of sust also. So then again, I asked him, did you do Panchakarma when you went to that doctor? He said, no, I did not do, because my wife said no. When I went and told wife at home, no, so she said no, because it's so hot, so you are not doing Panchakarma. And he said, that is again, he said, it is my biggest problem, that whatever I say, wife always says, you don't have any problem, you don't need any treatment. So no, you are not doing. Because whenever he used to keep on complaining that I also have a depression, I don't like to go out, I don't like to do anything. So wife used to tell you, where you have a depression? You are going to to give the rotis to the cow. You are going to give the chana to the pigeons. You are going out whenever you want. You are going for a walk. Where is the depression? Where are you sitting at home? You do not have a depression. So you do not think you have a depression, and don't talk about it. So the patient's wife is a very strong lady, and when the wife is saying this, the patient is just not able to do anything. He just is not able to say anything. He keeps quiet, and then he just is not going ahead with whatever he is thinking about. So here, what I thought was it is like, in Alumina we have this very wonderful rubric, that ailments from suppression of a left-handed writing. Now, what is this left-handed writing? When the child, tries to learn the writing, he doesn't know, either he may pick up the pen from the left hand or he may pick up the pen from the right hand. So there was an era where, the people used to always believe that no, one has to write only with the right hand. That is the right way of writing. That is the right way of doing the things. So if the child is trying to hold the pen with the left hand or trying to write with the left hand, then there will be, the instructions coming from the parents or from the elders in the house that no, you hold the pen in the right hand. You try to write with the right hand. So that time, if the patient is having that inborn thing of, writing it with a left hand, if he is a lefty, what will happen to his qualities is that he will have to suppress his qualities, and he will pick up the pen with the right. He will follow what the parents will say, and he will try to write with the right hand. So here in Alumina, we have seen that there is a lot of, this suppression of this qualities of the patients, and because Like alumina is only the single metal which is into the yielding also. So they would follow whatever the parents are saying. They think that okay, whatever the elders are saying, it is for his good. Then they would try to do it the other way. Whatever they are saying, they will try to follow it. So I thought about this rubric over here. Another thing is this patient is quite average, and I found him also absent-minded. That what he gave one example that he visited one doctor once, and when he was sitting in the waiting room of that area of that patient, of that doctor, what one patient told him that I got a note from so and so trust, and because I have a note, I will get the concession. So do you also have a note? So patient realized he doesn't have. So he immediately left that, doctors, the consultant's clinic. He went to that trust, which was quite far. Still he went by the bus. He went there. He took a note from the concession note from that trust. He returned and then he came to the doctor the next day. So I found that quality of avarice in him. But this he did, and after that, whenever that gastroenterologist whom he had visited, he suggested him to undergo the colonoscopy. So he went ahead with the colonoscopy, but that time he didn't bring the note from the trust. So he didn't get any concession for the colonoscopy. So that when he realized, he felt I went blank and I did not understand. I didn't realize also, okay, I had to bring the note at that time also. So I paid full amount. Then he used to understand that how he was spending money on to the doctors, one after another. So what he said is कि डॉक्टर मेरा पैसा भी गया और मुझे शारीरिक सुख भी कुछ भी नहीं मिला. So because he was spending it everywhere. And friends, this is the quality of improvident. What is improvident? It is the thoughtless spending of the money. Like, you are not thinking about it and you are just spending. And you do not have any foresight. There is no planning. You are not even planning for your future. And you are just spending the money in a way like which is unwise, which is not, you are not spending it wisely. And that is improvident. And this improvident is a very, very it has very few remedies in it and a very good quality of a alumina patient. Also, the patient had lot of weakness of the memory, and he reads the newspapers and he will say, I will read from first page to last page, but if I keep it aside, I don't remember anything. He did take some time, to remember a few things, like there were some long pauses in whatever he was saying. He took time to remember the names of the doctors or wherever he visited also. So also the wife said, we need to tell him repeatedly. If the work is allotted to him, he will write it down, and wife also needs to remind him. Next. Aditi, next. You are going previous.
Yeah.
Next. So work-wise, like, when I try to understand his, like, now he is a retired person, but how was he in his work and what was it? So he is a businessman, and he was like working, he had his rationing shop, and he was very, very hard working. He has worked very hard day and night, without seeing anything. And he said, I have worked for 50 years and I have hardly taken 2 months holidays in this 50 years of one day. But he has not taken a single vacation in this 50 years. And he earned a lot for his father. It was a joint family. So he had 5 brothers and he earned for his family, and he earned and it gave it to his father. So one very peculiar sentence that time he said, Doctor, I have worked 30 years for my father's sons and 20 years for my son. So like here also when I'm saying, when he said about my father's son, he literally took the name of the father that I earned 30 years for his father's name, his son, and his other sons. And for 20 years, he took his name, as if he is talking about himself or he is talking about somebody else next. So like it was getting confused in my mind, what is he saying? What is he thinking about himself? Is he having understanding that who is he? Is he talking about himself, or where is he when he's talking about father's sons and when he's saying about his son? But where is he himself? So is he really having this identity issue? Next. But at the same time, he also felt that the God has given him the good fruits of whatever hard work he did, and he is well off now. And half of the properties that he and his family bought, they were on his name. So even after the father's death, he gave and he signed the properties for the respected brothers for whom the father had bought. So he, like that, he was quite an anxiety conscious person also. And he said he could have kept it on his own name, but he did give it to everybody whose property father had thought he had brought it for. Also, I felt, when he was describing lot of things, like, his ego and his haughtiness was coming up quite prominently. Like, the way he said, I owned half of the properties of father and half was owned by the other five brothers. And he said, I was the only one who would handle father's court cases and I would win it. And seeing my walking and talking style, the BMC officer also got impressed and he did my work. So he said कि that BMC officer ने मुझे चाय भी पिलाया. अरे वो किसी को तो पानी तक नहीं पिलाता है. So the family and the others, अगर मैं किसी को बोलूँगा तो they were surprised. अरे वो officer तो किसी को चाय भी पानी भी नहीं पिलाता. आपको चाय पिलाया? So next. So he said कि because I am a very sweet tongue person and I have shehad, honey on my tongue, and I talk very sweetly. So when I talk sweetly, all my work is done. And my work never stops. And I have a good hold on my business also. I also thank auto वाला कि even though हम उसको पैसा देते तो क्या हुआ, हम उसको भी मैं thank you बोलता हूँ. And I have a very good prestige in my area. So because I have not done any beimani anytime, and I help all the needy people also, like in my nearby areas, nearby my shop. So, but that time, like wife was sitting there. So wife said ki, but he is like very obstinate also. He feels ki what I say is only right, and like meaning the way wife said that he is an obstinate person and he resists the wishes of others. He will like to do whatever he feels right only. And he also said immediately to wife also, ki, I am doing because I feel it is right and I am saving money, I do it properly. So where is the question? And this happens in the Alumina patient because Alumina is a very narrow-minded person, If you see in the try to understand Alumina, then they are quite obstinate because they are very narrow-minded. So when I tried to repertorize all these rubrics, so I took Ardent because of his hard work and he was very passionate and zealous and ardent in his work. So he was ardent, obstinate, resisting the wishes of others, anxiety driving from place to place. He was visiting one doctor to another, and with that, the fear of impending disease, which is incurable. And he had that impulse, which was morbid, to do the absurd things. Now, what is absurd? Absurd is something which you are doing, which is unreasonable, which is illogical, which is inappropriate. You are not realizing it and you keep on doing. So that is what is the impulse morbid that the Alumina has. And the delusion, head belongs to another. Like this is one rubric which gives a identity to the Alumina patients, where they have confusion of identity and they've lost their identity. So also the weakness memory of the answering vaguely, which is also very characteristic because they have a lot of confusion of mind. That is how they cannot pinpoint, they cannot have that clarity, and their answers are quite vague. And he was also absent-minded, avaricious, and improvident. Also egotism, illusion, great person he is, anxiety conscience of, he was very pessimistic in few of the things, when he used to worry about his grandson going out, returning home late, he would think about all negative things only which would come to his mind. One very important rubric that I found in this patient, which was laughing contemptuous. This is a single remedy rubric of Alumina. So what had happened is when I was, because I was getting confused, in understanding this patient, Alumina was not my first prescription. It was after giving 2-3 medicines, I came to Alumina. So what was like when he was describing the going to this doctor and that doctor and this degree and that degree and like the way he was saying as if they were the big doctors, and like he visited so and so doctors. And when I told him asked him about the homeopathy, he also told me I had met you about 1 year ago. That time also I had told you about my complaint, and you told me okay, you will get better, but I did not come. And now also, as soon as he said, because the daughter-in-law brought him, he came to homeopathy. So somewhere I got that feel he is thinking, I went to so many big doctors and I am not getting relief in my complaint. What is this homeopathy going to do? And this is what I felt, and that too he was saying, laughing and leaving the things halfway. So I felt that was his laughing contemptuousness. He was looking and derogating the homeopathy also. And that is because the Alumina is in narrow-mindedness, and Alumina is also there in depersonalization. If we see and elements from suppression of left-handed writing. So what happens is because they are suppressed from doing whatever they wish to, at the same time they are so much confused about their own self, about their identity, they do not realize what is their wish, what they want to do. And that is how it happens that over a period of time we can see that okay, their personality is completely changing. A person who was so hardworking initially, who is saying I worked for 50 years without taking any holidays, who is again ending up into the type of thing where he is having a lot of this anxiety, going from one place to another, unable to take decision for his own self. So the remedy which was given was a alumina, which is a very weak and a soft metal. So we will see some qualities of metal, but because it is a soft metal and a weak metal, it will not come out like prominently the hard qualities of the metals. And it is a common metal; it is not a noble metal. So we will see those type of qualities. If we see in the Materia Medica, it is given like the alumina is given in confusion and retention. Also in the mind, the first thing which has been described is the vagueness, and there is no clear symptoms come out, which we also saw in our patient. And he seems closed, self-protective, slowness, the slow comprehension. This is very important, the dullness and the comprehension, because they are not able to comprehend the things, whatever is coming to their mind. That is why there is a slowness which is coming up and the confusion which is ending up. Also, they answer slowly and vaguely. This, it seems, not involved and speaks monotonous, difficult in expressing himself or his problems. He rubs forehead. The mind seems constipated, The constipation is there at the level of the physic for sure, but at the same time, there is a constipation, there is a retention at the level of the mind also. And restricted imagination, irresolution, incomprehension, don't tolerate pressure, especially of time, sensation of being hurried inside, and they can't stand being hurried, cannot do two things at the same time. They can have notes to make sure that they do not forget things, work hard to overcome the slowness. So this is coming up as a like defense mechanism that we see in the patients. There is an aversion to conversation, which is aggravated in the morning, and they can't comprehend what everybody is talking about. They withhold the feelings. They release anger only towards family members. Notices mental problems. There is a fear of insanity and confusion of the identity. Who am I? When they talk, they think that someone else is talking, and everything seems unreal. Also, the fear of knives, blood, cockroaches, disease, epilepsy, and the evil spirits is seen characteristically in alumina. I did not find in this patient. We will not see every aspect in every patient, but yeah, this is also one important aspect of alumina. And they have this morbid impulse to kill or to hurt when seeing the knife and the blood. Anxiety, despair of recovery, and depression. Also the dryness which is seen at the level of the physical as well as the mind level. Yeah, Aditi. So after giving him alumina, I started with the alumina 30 in a daily doses. And then I slowly went on to 30 to 200 and 1M and 10M. And I found a very good thing, the best thing, which the wife was relieved, because the patient has stopped going from doctors to doctors, and he literally stick to the homeopathy. And which wife was saying ki this has never happened with the patient, that okay, he got ready to take homeopathy and he really stick with the homeopathy. So his confidence in homeopathy had increased. At times it used to happen that, okay, if there is a gap of 1 or 2 weeks, then he would remind his wife, okay, we have to go to the homeopathy, and he would come and he will tell me, doctor, you give me that bedtime powder which you are giving me every day. Because with that, I am getting a good bowels and my constipation is reduced. He has stopped taking cremafin, which he used to take for years together. His sleep, appetite improved, weakness and the energy levels also improved, and he was feeling better and fresh. So with this, friends, I will go to another case. There is a case of a 14-year-old male patient. I would describe it in a short, but the very important aspects, which is again the unique, what we are seeing into this patient. Now, this child was brought by the mother, and he was brought for the weakness of memory and very poor academics. So he also had mild mental retardation and confusion of mind. There was no control over his stool. He's 14 years old. Still, he's soiling the pants, and he is having the easy tiredness. So the birth history which was taken was like it was a full-term baby. The birth weight was also normal. Mother had a prolonged labor with meconium stain. There was an asphyxia with epilepsy followed by the birth after birth, and patient was kept in incubator and oxygen for 1 month. But all his milestones were normal, and but still the patient was seen that he was having a lot of weakness and he was feeling ill very frequently. So mother was worried what is happening to him and why is he falling ill frequently. And he had lot of weakness of memory, very bad. And the schools, there were a lot of complaints coming from the schools, and he was doing a lot of mistakes in identifying the alphabets. And mother had to teach him literally 10 times. And he would still forget what is taught, and whatever instructions were given to him, he will forget it within a very short time. He couldn't do even the simple plus and minus, the addition, subtractions. And he was very weak in the mathematics, calculations, accounts, handling the money. If mother would give him some money and tell him to go and buy something from the shop, he would not be able to come and give its account, that okay, how much it costed for and how much money is remaining. He could not give it to the mother. So he's 14 years old. So now definitely the mother, it was a worry thing for the mother. And mother said he is literally failing in almost all the subjects. And he can't remember even 2 to 3 things given to him at a time. So if we tell him to go and to buy a book, he will go and buy a pen. So he's also gets confused in everything, and he doesn't have any confidence. He answers just in monosyllables. And here, the mother was almost in the tears, and she said, doctor, I have hit him very much because I was getting frustrated because of his learning problem, that I'm teaching him 10 times, and why is he not understanding? Why is he not remembering? Why is he getting confused? I'm telling him to do one thing and he's doing the second thing. So mother was literally feeling, very this thing. So she felt that she had hit him a lot and hit him very hard. So which must be having some bad effect onto the patient. Also, one more thing which I had observed in this patient was that when I asked him, the simple things, when I started with the interview, I asked him, okay, what is your name? Which school you are going? What are you studying? What is the name of your friends? So there was always he was taking a long pauses. He was thinking about remembering, and he was reflecting long before answering. So in Alumina, we have this rubric, very, very good rubric, the answering reflecting long. And this is a rubric, this is something which we can see in the patient. We can just observe in the patient, and we can find it out. And as if homeopath, we must have this observation of us very sharp and accurate, and we should not miss it out, because there are very few remedies in it, and Alumina is one of them. So I had observed, the mother described two peculiar incidences in the patient's about the patient. She said, when he was small and he was going to school, doctor, what happened that one day, instead of going to the class, what happened is there was a meter box and the meter box door was kept open by the peon over there. So this boy, he went and sat down in the meter box instead of going into the class. So that is how mother was laughing. See, doctor, how, meaning, he did what he did. And the second incident that the mother described, that every day I used to, when he was small, I used to take him to the temple every day. I used to give him some coins to put it in the donation box, and every day he would put. So one day what happened, they went to the temple, but somebody met mother. So mother was talking to someone, and what this patient did was, he had a purse in his hand. So he took out the 100 rupees notes from the purse, and he put it in the donation box. He already put few notes of 100 rupees. Then he was trying to, empty the whole purse into the donation box. And there was a neighbor of them who was there just standing in the temple next to this boy, and she observed this patient. And she literally just held the boy's hand. Oh, what are you doing? And then mother came, and mother said, doctor, he didn't even realize, I was teaching him every day. I was giving him 1 coin every day to put it into the donation box. Still, he was just emptying the whole box. Like, as if he was like not attentive to whatever was told or whatever was taught to him all these days, what was happening. He was not attentive. Where was his classroom and where is a meter box? Where he should go? He didn't realize that also. So what was coming up was that he's not attentive, not observing type of person. He's not sharp. He's a very like dull type of person who is going into lot of confusion. At the same time, he's becoming absent-minded. He doesn't realize only. So that time, the rubric that struck me was absent-minded inadvertence. Now, what is this inadvertent? Like, it is the act which is done not with the intention. It is not done with any deliberate planning, but it is just done through your absent-minded mind that you are just doing it. So he didn't put that money deliberately. Okay, I want to put all this money into the donation box of the temple. That is why I'm putting it. No, he was not doing. He was just like into his own absent-mindedness. He was trying to put that money without understanding, without observing, without being attentive to it. So this rubric, absent-minded inadvertence, was taken. Also, there were some observation about him which I saw during the clinic was that he was very quiet and he was smiling continuously. And he was giving these pauses before replying, and he was also replying very vaguely. Also, there was a childish look. He didn't appear to me of 14-year-old, and he was absorbed in his thoughts at times when I'm talking to mother. So the rubrics that I took was absent-minded inadvertence, indiscretion, unobserving, mathematics inability for calculating, mental exertion, aggravation, impossible, memory, loss of memory, answering, reflecting long, childish behavior, quiet disposition, confusion of mind when spoken to, confidence, want of self-confidence, and imbecility. And the remedy which was covering all the rubrics was Alumina. So the Alumina was given to him in 30, 200 and 1 m doses, single dose weekly I started with. And within just few days, the first thing that I observed was a maturity on his face. Next time when he came, like, I felt oh, okay, there is a definite maturity change on his face. That childish look which was there has changed. Also, his involuntary stools stopped completely. He had a very good control over his bowel movements. He was like now started talking and mixing with people much better. He was following and remembering the instructions of the mother given by the mother and the school teacher very much, and he used to follow that much properly. And his confusion had reduced, and he used to do the things also like which were quite little sensible, and his memory also had improved. His academics also improved. After that, he did not fail much into the exams. Like today, recently again the mother had come with for her the patient's younger brother. That time again, she told that this patient is much better, and he passed his, when he came to us, he was in 9th standard, but after that, his 10th, 11th, 12th, 13th, all the standards he passed in the first attempt itself. And he was doing good in his academics, although he is not scoring very high, but at least he's passing out in the first attempt. So yeah, friends, these are the two cases of the Alumina, which I tried to share my experience, and I tried to share the rubrics and my understanding. So friends, we also have Dr. Kushala, who also has a wonderful experience of Alumina and in a middle-aged men. So yeah, Kushala, can you share your experience of the patient?
Yes.
Alumina patient?
Yes, surely. So, Dr. Shobha has explained in depth all the rubrics and correlated with two cases. So, I shall not go into the explanation of rubrics, but this is a very classical book picture case of Alumina of mine. So, this young man, around 32, came to me in Feb 2017, and he was working along with his father. They had a business of iron molding, and he's the only son, married. He has a young daughter. So since 4 years, he's suffering from a lot of this allergic cold with headache, cough, nose block, and he I feel very uneasy, irritated. My work efficiency goes down and I cannot concentrate. I feel like sleeping. So I went into his life space. He said, I'm the only son and I'm pampered. There's never a time when I got a no from my parents. They have given me all the things. And I get extremely angry if my wife, if she doesn't listen. I feel that she should sit down and sweep. And if she stands and sweeps, I don't like it. I tell her that, no, this is the way it has to be done. So wherever it's possible for him to exert his force, he is sort of obstinate. He said that my father is a dominating force at home, and he still works at the factory in spite of being an age of 62. And he's very strong on his decisions. He supports the entire family and nobody says no to him. And the mother is also dominating and everybody has to follow, the mother's instructions, the father's instruction, and mother too follows the father's decisions. He said, I'm an average student in school. I wanted to do commerce. Why? Because my friends were to do. Father said, do science. Friends are not going to support you. Father had already planned, you get 50% in 12th standard, and then you do your diploma course in that molding industry. So I got 49%. He never pressurized me to study, but then I did my BSc and then I joined the iron molding course. And they only chose the girl for marriage for me. So some of the rubrics which you can, associate with is ailments from left-handed suppression. He's just, doing what his father says. Delusion head belongs to another. Delusion robot one is just mechanically just following somebody's instruction. Delusion mirror face, seeing everybody's face in the mirror except his own. Where is his identity? Delusion numbing. I mean, this is much more morbid state where, you're just not functioning. You're just following. Mother is a housekeeper and she too wants everything her way. To the extent that, the amount of pampering he receives, that the mother keeps money in the purse, he keeps the towel ready for his bath, is so pampered and very dependent. He said, I don't have a single rupee in my bank balance. And if I have to go out with my wife, I have to ask my father for the money. And he will say, you just went out. I feel bad that I can't support my wife. And wife tells me, you should have joined office instead of business. So you could have taken your own decision. So your mind would have started working. And this was what the wife's, what she saw in him. So delusion consciousness belongs to other. You're childish, dependent, anxiety. He has that feeling that I'm not really doing my duty towards my wife. The young couple, they can't even go out without permission. I can't take my decision. All my decisions are influenced by my father. I feel hurt. I'm not up to the mark of what my father expected. We have not grown in business. I have to work like a layman. So he's very irresolute. He is indecisive. He doesn't have the capacity, business incapacity for. Today my father's there. Tomorrow when he's not there, how will I look after my wife and kid? I lack decision-making ability. I'm not bold enough to take decisions and responsibilities. Whatever I take up, I do for some time and then I leave it. I don't know what I want to become. I am not after money. See the, pathetic state of affairs that a 32-year-old man says, I don't know what I want to become. So you see anxiety about future. You see ideas deficiency of, you see confusion of identity as to his duality sense of, I don't know what I want to become. Persists in nothing. At age 33, I should be taking my own decision. But even after marriage, I'm depending on father. Wife gets troubled because parents are so dominating. They're not lenient. She says, if I was strong, at least she would not have been shouted at. I could have stood by her. I feel I'm better that she does a job so that she's out of the house for some time. Wife shouts and says things to me. Father is orthodox. He doesn't allow them to go for, movie or any outings, or he says that in Amavasya, you should not go out. In Purnima, you should not go out. You should not go out to eat in any hotel. I feel helpless. Personally, I don't feel to go out because if I have to go, then again, I have to ask money from my father. Helpless, timidity, will weakness of, he reproaches himself. He feels very sad that, the problem is in me. I should have made a proper source of income and then got married. I have not done that much. Up to the potential, that negative emotion is in me. I can't speak to new people also properly. I feel anxious what to speak, how to speak. I feel guilty. It hurts me that even at the age of 62, my father still has to work and I can't make him sit at home. At age 33, when will I stand on my feet? At least I should be able to support my family. Confidence, want of self-confidence, anxiety of conscience, delusion, duty as if he had not done his. Anxiety is very sad when he thinks about himself, from sad thoughts. Anxiety when speaking. I don't have special interest in any field. Since father was there, I've just continued in this. Father said continue, so I continued. Delusion sees something when it seems as though he saw through someone else's eyes. It's like you are not existed. Everything is happening through somebody else. Delusion outside his body, someone else saw or spoke. And he has been attached to the ISKCON Institute for pretty long. And he likes to go there and be there. And he often goes. So Alumina also has religious affections to occupy with. I did give him infrequent doses of alumina, and the first thing is his allergies came well under control, and he took up a job and he started working in a office setup where he was, going regularly and earning a salary. So that sort of at least helped him to fend for himself and his wife and, gave him that some levi or some ego where he could stand up for himself. So I think Aditi.
Yeah. Yeah, thank you, Kushala and Shobha. Very beautifully described mind of alumina and the whole mental makeup of alumina. Through different cases, we have understood alumina so very well. And now I will just briefly, since we are here for an integrated approach, I will just give you a brief idea about the physical aspect of the alumina. What is there in alumina, because in homeopathy we always believe in totality, and if we bring mind and body together in the holistic picture, the prescription is short confirmation. As we have understood, alumina is very confused and all. So alumina's sphere of action is on the nerves, on the spinal cord, and on the skin. These three are very important, and fourth is digestive system. These are the very, very important spheres where Alumina shows prominent actions. And we have all learned that Alumina has a very bad constipation. And what is the constipation of Alumina? It is always the soft stool, and there is no force to bring out the stool from the rectum. Now that force, why the force is not there? Because the rectal muscles are kind of in a stage of paresis. And that is why Alumina patient has to really strain a lot in order to even bring out the clayey soft stool. So this is the constipation of Alumina, which we can explain through paresis and paralysis of the muscles. Same way, even Alumina has squint and ptosis of eye muscles, because again, internal rectus muscles of the eyeballs are paralyzed or paresed. So these are the physical symptoms which are coming through the nerve affections of the different organs. Then there is another thing about the dryness. There is a severe dryness in Alumina. And this dryness causes severe itching especially in the winter season. We see Alumina eruptions coming up and severe itching, and to the extent of bleeding, that much of itching. Then the third point is indigestibility. Now, as we have understood through these cases, that Alumina has not a mind of his own. Secondly, he is very confused personality, somewhere depersonalization, somewhere identity issues, somewhere not very intellectually sharp that we have seen. Same thing we see even in Alumina's cravings, indigestible things, pica, mud, chalk, all these things are very prominent in Alumina. We may not see all the symptoms in all the patients, but we can catch some symptoms in every patient. Then there is this sensory affection. So similar to the paresis and paralysis, Alumina has a very strong effect on the sensory nerves. And that is why Alumina has lot of numbness and tingling and crawling sensations. Even if they sit for a long time, their legs become numb, their hips and thighs become numb, or some kind of crawling sensation, tingling sensation, they start feeling. So that is also very prominently seen in Alumina. So I think this is in nutshell about the physical part of the Alumina. And now I'll invite Nirupama. Dr. Nirupama, please throw some light on Alumina as a mineral kingdom and through
Yeah,
periodic.
yes, Aditi. So, if you see through the cases also, like alumina in mineral chart, it belongs to third row of the development and third column. So, third row is basically where you are forming your identity. And third column is the early toddler, where it causes a lot of confusion. So, typically, if you see alumina, there is a confusion of identity. Who am I? Like if I'm Nirupama Agarwal, so my confusion will be, am I Agarwal or I have my separate identity as a Nirupama? So that is the confusion. So, and it's early toddler where they are not able to take decisions. They find it easy to follow parents. Not necessarily parents should be dominating, controlling. They may be or may not be. But here, the ego has not formed. Brain is, see, what is the level of development? They're infant and going towards toddler. So they're learning to talk, learning to walk, learning to do activities. And in this stage, when they're not able to take any decision, it's easy for them to follow their parents. What happens, like typically that symptom, left hand suppression. If you see the stage of development where child himself is not very clear whether he is able to use left hand or a right hand. But what happens when parents give pain in right hand, they start using that right hand. They do not realize that I'm not using left hand. But problem comes when they grow up and they realize I'm not able to take stands. I'm not able to take decision for myself, and then they feel my parents didn't allow me to take my own decisions, and there that aggression, difficulty, lamenting, all that starts after that. So basically, it's an early toddler who is very confused. Actually, this is the stage which is very moldable stage. You can mold as you want. And Alumina, a child has no ego, no strength to stand. They follow their parents happily. But the problem comes when they go out and not able to take stand, and where there that aggression also comes. And that's why we see a lot of rubrics like impulse to kill and the uh, aversion to look at blood, because that is the aggression it's there inside, which is like even first case, if you see, that man was quite frustrated with his own difficulty. He was not able to take stand and he was quite frustrated with that, and that's why he was suffering. The sufferings come later when they are not able to take stand for themselves. That is what is my understanding about this Alumina. Anita, you can throw some light if you feel anything is missing in overall understanding.
I think Shobha and Kushala have described their cases very beautifully, and they have covered the majority part of the understanding. And they have also explained the rubrics in detail. So I just wanted to add one thing, that because of their narrow-mindedness and because of, lack of any ideas or lack of lateral thinking or creative thinking, how they come across is very monotonous, dry,
Yes.
telling plain, communicative, expansive, because they can't describe anything very to the point. So they will go round and round, and then, finally, actually, they don't know what they want to convey. So they will be communicative, expansive. So these are some observations from where you can, enter Alumina. Like she said, reflecting long before answering. Confusion is very, evident on their face. They take long time to answer. They take long time to think. And still they are not very clear that they have communicated enough or they have communicated clearly. That one thing I wanted to add, because I also had one old patient of Alumina who had constipation, tingling, numbness and all that. And he was so confused that he was literally, blank, and he kept saying, I don't know what is happening to me. So he was just not, able to pinpoint what his problem was. And he was not able to communicate his problems to his wife as well as his son, though his son was very keen to help him. And where he was stuck was, because of COVID and all, he was not going to the bank and doing all the account work and all. So he was finding it very difficult to operate the accounts online or paying online. So, and also documentation of his office, of his business and all that. So a lot of difficulty was there, but then there was so much confusion that he couldn't seek help from his son also. Though son is CA and son was ready to help him. So this is how, they are not even aware of what problem they are facing and how to find a solution for that. So that also, leads to a lot of anxiety. Second point which I wanted to clarify is left-handed suppression, which you talked about. So what is left-handed writing? See, it is always opposite. Right brain is more active in left when you are using left hand. Right brain has to do with more of creativity, ideas, abstract ideas, art, communication, and the left hand is connected to the right brain. Right hand is connected to the left brain, which is more logical, which is more of learned behavior. So Alumina loses its originality or whatever original ideas they have, whatever spontaneity is there, that is lost because of the pressure of writing with right hand. So what they behave is whatever they have learned from others. So they don't have their own original identity, but they take up the identity of people around them. So that is how, which explains head belongs to other also. So there may not be domination, there may not be any abuse in Alumina, but still because of confusion, they don't know how to do it, and they find an easy way out by following others, by yielding to others. So I think, yeah, about absent-minded inadvertence also, I wanted to clarify a bit, because advertence is paying attention. So inadvertence is not paying attention. So absent-minded inadvertence totally means that because you are fixed on one aspect and you have narrow mind, so you are not able to accept other ideas. And because you are preoccupied with one type of thinking, you are not open, or you are not able to give attention to other type of thinking. So that also, it presents as if, they are very obstinate and they are resisting wishes of others, but they don't have that much of brain to think about different ways to do a thing. They are fixed to one thing. So there was a case which Dr. Mayuresh had described where, patient was fixed that she had to undergo knee replacement because she had osteoarthritis of knee. So even if, other doctors said that it is a beginning stage and surgery is not required, or relatives also were against it, but she was so fixed that she underwent the surgery. So because they are not open to other ways or open to other type of thinking, or they have lack of, ideas, deficiency of ideas. So this is absent-minded inadvertence. And indiscretion is also there, which also leads to improvident. I think that's all. If anybody wants to add anything.
I think we have covered majority of the things. Right?
We will wind up the session.
So, yeah, with this, thank you very much, everybody.
And happy Holi to everyone.
Yeah,
Happy Holi.
happy Holi. See
See
you
you
all
in our
soon
next
in
dynamic
the next.
session.
Yeah. Okay.
Thank
Bye.
you.
Bye. Thank you.